You are watching the Doctalk Show.
Welcome back. We are discussing dental hygiene, in particular bad breath. If you have bad breath, you should always see a dentist who will do thorough evaluation to see what could be causing the bad breath. How about, there are some foods people complain about, the garlics. Is it true it will cause bad breath?
Yeah, garlic, actually, foods like garlic and onions, they do actually cause bad breath. Yeah, it
Do
would
they
be
also,
bad breath in the
like
sense
they get
that,
deposited in the teeth?
not necessarily, but when you take the garlic and you then take the onions, they're broken down to substances which contain sulfur vapors. And then in the end, that breakdown of those substances, it will, exactly, it will
comes
reflux.
from the stomach.
Comes from the
and
stomach,
comes out
refluxes
as
back.
gas.
Yeah.
Okay. So
I just wanted to add something little to other causes within the mouth.
Yes.
Also, patients with oral cancers, sometimes they can have bad breath. Oral cancers, because these are like, most of them are ulcerated, they're like wounds. And the chronic wound, an ulcer is a chronic wound, it doesn't heal over time. So it's always attracting bacteria. In the end, it will end up giving off a bad breath. Then also, some patients have reduced salivary flow in some conditions. Yeah, once your saliva flow is down in the mouth, maybe due to diabetes, there are some other stress. There are some other syndromes like Sjogren's. All that can result into a bad breath.
Why is saliva important in this case?
Saliva, what actually saliva does in the mouth is supposed to combat the bacteria. So once you have saliva, it buffers the acids that are, which is the actual needed media for bacteria to grow and proliferate in your mouth. And then also, in addition to that, is that saliva itself, it has the buffering effect.
A buffering.
Buffering, it
balances the pH.
Remember,
of the media.
the acids are acidic. The bacteria produces acids. Yes, yes. But for the mouth to be really healthy, there has to be that balance. Not so much of acid, not so much of alkaline. Alkaline is the other end. So the saliva just keeps balancing the two so that the mouth is healthy. Yes.
And then
so
also the cleansing
saliva
effect
will dilute the acids in a way, and to prevent the bacteria from flourishing.
And also the biggest component of saliva is water. So water is very important in that it will dilute whatever it is that you've eaten and you swallow it. You get. So the fact that there is always water in the mouth, the soft tissues are soft enough, so food doesn't linger around. That's why when you go to sleep, you have to brush, so that when the saliva is not a lot, there is still not a lot of dirt.
Just a minute. When you go to sleep, you should brush. How is that linked to the saliva?
When someone goes to sleep, saliva flow slows down. And yet remember, the saliva is also helping us to reduce the halitosis. That's why you find that everyone, any normal person, when you wake up, trust me, even if you're very good at your hygiene, everyone, when you wake up, there's just that not good breath. In that, if you forget to brush and you're this self-conscious person, you will not be comfortable until you brush. So the brushing in the morning is very important, because then you will notice that the saliva will have reduced and there's just that not so good breath in the morning.
So saliva plays a very big role in preventing the bad breath. And so people love to smoke a lot. But this smoke, well, you're the experts, but I know it tends to stay in the teeth and can cause very bad odor because of the chemicals that they might cause some bit of tooth decay, or they might injure the gum and result in the bad breath. So smoking also is another important factor that might contribute to the bad breath, the halitosis.
Okay. True.
So, so those are just factors regarding the mouth
itself.
But there might be other diseases occurring elsewhere in the body that also present as bad breath. We learned that certain conditions of the mouth can cause bad breath, such as dental caries, or forgetting to brush the tongue, or other conditions such as smoking can all result in bad breath. However, there could be other problems occurring elsewhere in the body, not only in the mouth. It occurs elsewhere in the body but presents as bad breath. So, Dr. Deborah, what could these problems be? They're called the systemic diseases because they occur in other systems apart from the mouth.
One of them is respiratory issues.
That is regarding the lungs,
the breathing.
The breathing system.
Yes, we might have problems in the upper respiratory tracts. That is the throat, the bronchus. Those are channels, the air pipes. The air pipes. When those air pipes have infection or the lungs themselves have infection, most times there is production of a lot of mucus. A lot of mucus when there are conditions, not only in the lower respiratory, but also like in the nasal areas. In case of any infection, there's a lot of mucus. It's like just a trigger. So there's a lot of mucus that is produced. And remember, infection comes with germs. These germs also want something to feed on. Now, in these infections, the germs will feed on the mucus, if you notice. The germs will feed on the mucus, and it produces the outcome of decomposed mucus is not good. That's why you find people with stinky halitosis, but it's not really understandable. Sometimes it can be coming from the sinuses, or
so sinuses can cause bad breath.
Bad breath, yes.
And certain conditions of the air system, especially where there is production of the sputum and the mucus, that can present with the bad breath. Okay, so other than the breathing system, could there be any other organs that would result in bad breath?
Yeah, beside the breathing system, basically here we are looking at systems that have an interconnection with the oral cavity. And the other system is the GIT, that is exactly the alimentary canal. So you find that certain conditions within that system could also equally give you bad breath, irrespective of good oral hygiene. You brush well, you have no decay, you have no gum disease, but then you have halitosis. And to mention a few examples of the disease entities in that system, could have conditions like chronic peptic ulcer disease. Those are chronic wounds within your stomach, they don't heal. Okay. That a chronic wound will always give you that bad breath, so it will just reflux back.
Yeah, and the other issue would be stress. Most times when we find ourselves in situations that sometimes we can't tell what exactly is the problem. So stress can reduce, it just reduces everything. You just find someone dehydrated. You find someone not taking good care of themselves. They just choose to neglect themselves until someone sits them down and probably find out what exactly is the problem. So stress can just cause self-neglect, and self-neglect is not just self-neglect. Even the mouth can be neglected in the process. You find someone staying in bed the whole time and not do their routine. Yes, everything will find them in bed, which is not good. So you find that they are not attending to what they are supposed to attend at what particular time. They are not brushing at the right time. They are consuming things they are not supposed to consume. Remember, sometimes when you're stressed, people eat. It's like a stress reliever, but you don't know what exactly you're doing to yourself.
So that you find they eat the wrong food.
The wrong foods.
The cakes.
Yes, that is
those
it.
cause the curries and then all that.
And bad breath, yes. So stress is also a factor.
Okay.
Yeah.
You are watching the Doctalk Show.